Is it audible now? Hello?
Got a message asking if they can hear. Can you hear? No, not. They can't hear anything. Can see you? You can hear?
Yes, we can hear.
Thank you. Sorry for the technical glitch. So can you hear me now?
Yes,
ma'am. Yes, ma'am.
Right. So when we were talking about immunity, right? So basically, we are born with something, some kind of immunity, and fortunately, that's because our mothers have passed it on to us, and then our body starts developing a little bit of immunity. And slowly we develop the immunity. That means we develop the ability to fight the infection. So we are blessed that way. So we have two types, that is innate and adaptive. So I'll tell you a little later about it. It's not really necessary. That's only for you guys to understand that, when we talk about immunity, yes, you're all blessed with it. And active immunity is when you get naturally the disease. The body develops immunity, or it develops the ability to fight the infection, and the next time, as soon as the antigen or the bacteria enters the body, it recognizes it and starts fighting it, right? So that's active immunity, and it is by two types. One is by when you get the disease per se, and the other one is by vaccination. So active immunity, when you get yourself vaccinated, you are going to have the ability to fight the disease per se later. All right. So passive immunity is through artificial means. We have some monoclonal antibodies. There's a lot of research going on that. And maternal. That means if I'm pregnant and I get the disease, certain kinds of diseases, and I develop the immunity and I pass it on to my baby as well. That is the passive immunity. And sometimes as a mother, I get vaccinated during pregnancy and then pass on the immunity to the baby. So that is called as passive immunity, and the mother is blessed with doing that to the child. So there antigen is nothing but the toxin or the bacteria which enters our body is called an antigen. Antibody is nothing but the substance produced by the body or the immunoglobulins produced by the body to fight the disease. Right? So that is antigen and antibody when somebody is talking about it. So this is a simple science. Okay. Now, RNA is of two types. We are talking, why did I go into this? Is because I know most of you are reading now and they said about mRNA. So RNA is of two types, mRNA and tRNA. So we are talking more about mRNA vaccines these days. So that's why I've spoken to you about mRNA. And remember, RNA and DNA are two different things. DNA lives inside the nucleus, or it is per se carries the genetic material, and it is inside the nucleus of the cell, whereas mRNA is in the cytoplasm, right? Okay, so that's about the little bit of wordplay. And before we really go into it, if you have kids over there who are school going, can look at this picture, they will just identify it like this. These are two great people who gave us vaccines and what we are talking about today. And one is Edward Jenner, the other one is Louis Pasteur. I'm very sure most of you, if you have gone to Uti or Kunur or something like that, you would have seen the Louis Pasteur Institute. But Edward Jenner is the first person who has started about vaccinations. So this was all about smallpox. Okay, so he started it. So there are different types of vaccines when we talk about vaccinations. This is just for you guys to have an overall view, but just don't really put your head into it. So there are live attenuated vaccines. That means they are live virus, which we are going to give into you, but they are literally very weak. They cannot give you a disease per se. Or if you get the disease also, it's going to be very mild variant. You're not going to have a major chicken pox or an MMR or a measles at that point of time. So this is a live attenuated vaccines. Inactivated or dead vaccines, there are subunit vaccines, toxoids like the tetanus, which you take. There are conjugate vaccines. The DNA vaccines are being experimental, recombinant vector vaccines, and mRNA vaccines, which we are talking about for the COVID these days. So these are the types of vaccines, and there's a lot of research going on there. So Edward Jenner was the first person who wanted us, I mean, he was the father of vaccination, literally. He discovered the smallpox vaccine for us. Now, coming to the vaccines for adolescents. So we are talking about adolescents. I told you 10 to 19-year-old girls. So basically, we go to the pediatrician till the age of 10, and then totally we miss all the vaccine schedules later. But please make sure they get the list of vaccines which are here. Kindly look into it if they have finished these or not. The HPV vaccine, it is going to protect your child from human papilloma virus, which is also going to cause the cervical cancer. So there is this one beautiful vaccine which is coming to the market, which is going to protect your child from the cervical cancers of future. So vaginal warts and cervical cancers can be avoided if you can take the HPV vaccine. The HPV vaccines generally are given by the pediatricians these days. Please ask for it if you have missed it. So that's the human papilloma virus. Otherwise, you can ask the doctor for the cervical cancer vaccination. So it is given as 0, 1, and 6, or depending on the dose schedules which you have. There are two kinds of vaccines in India available. So depending on it, you will get your vaccination. Kindly ask your doctor or the pediatrician for the vaccine. And Tdap is nothing but the Boostrix vaccine, which we already give for the child as the baby is born. There are lots of, and this is just a booster dose, which we try to give between 10 to 19 years of age. Hepatitis A, hepatitis B, if in case you have missed the hepatitis B. Hepatitis A is, it's foodborne jaundice. That's what you get generally. Hepatitis B, in case you guys have missed it, generally we don't miss it because the vaccination schedules do contain hepatitis B. But in case you guys have missed it, please take the hepatitis B also. And polio vaccines, yes, this is in case you guys have missed, or IPV. These days we are giving injectable polio vaccines, so we are not giving oral vaccinations. So oral polio drops are not being given, IPVs are given, so you can talk about it. think about, talk to your doctor. And MMR, the mumps, measles, and rubella vaccination, very, very important. I'm very sure all of you have covered it, but if you think back some 2 years or 3 years back, the government of India has come back with revaccinating the children for MMR. So they started from the age of 5 and went to the age of 14. They gave back other dose of MMR vaccine for everybody. So the MMR vaccinations protect your child during the pregnancy, also for mumps, measles, and rubella, which is very scary to get during pregnancy. So please, if you have not given the MMR vaccination, check for it and get it sorted. Get the child an MMR vaccination. Chickenpox, please do it. I'm very sure, even though they are weak vaccinations, but it's better because we do not prefer a pregnant woman getting chickenpox, so better you get your vaccination prior to conceiving or during adolescence itself. I would surely prefer, and I've given it to my daughter. So meningococcal vaccines, yes, these are very, very important vaccines. Make sure you go towards your child's list. Look if you have covered all these vaccinations. Please get your child vaccinated. They are adolescents, 10 to 19. So please get all these vaccinations, especially if they're going abroad and they need all the vaccination lists to be complete. Now, coming to the vaccinations in pregnancy, so how does it affect? So most of them are very worried. They are only asking about tetanus shots. Madam, can I take tetanus vaccination? They're all only concerned about tetanus, and tetanus, but there are other vaccines also which are recommended in pregnancy. So why do we do that? I'll let you know in a short time. So the vaccinations in pregnancy, which we give to you, are very safe and they're very beneficial for both the mother and the fetus as well. It protects the mother and the fetus from the morbidity of certain infections, which we think are very dangerous to get in pregnancy. And this, whatever vaccine which we are giving, is going to protect the fetus. It's going to pass, in the first slide I have told you, the vaccinations or the disease to the mother will cause some passive immunity to the baby. That means the baby is born with a little bit of immunity to fight the disease, right? Because at birth, they're giving you some vaccines. They may take some time for the baby to develop that immunity, but we are already passing it through the placenta to the baby. Ideally, as I told you, during adolescent or preconceptional stage itself, finish your shots of vaccinations. So, but in certain situations, we don't mind vaccinating you during pregnancy as well. So vaccines are recommended during pregnancy are tetanus. Nowadays, we give it as TD, that is tetanus and diphtheria together. We give it as a vaccination. We do not give a tetanus shot, TT, so plain these days. We give as a combination. And TDAP, that is diphtheria, tetanus, diphtheria, and pertussis. So why are we giving this? We are giving this between 28 to 36 weeks of pregnancy. So why do we do this? We want to protect the baby from the whooping cough and pertussis or diphtheria as soon as the baby is born, because the baby is being that by the time the baby gets it, it's going to be another 6 weeks. And within the 6 weeks, we have seen some cases of baby developing diphtheria. So that's the reason why we are giving this to the mothers between 26 to 36 weeks of pregnancy. Tetanus, yeah, in the villages, it's a different schedule, but for us, probably at 13 to 16 weeks, we give 1 shot, or if you miss during your anomaly scan, that's at 20 weeks, we give 1 shot of tetanus and diphtheria, and the next shot will be the booster between 26 to 28. So the influenza vaccines, yes, now there are lots of new vaccines which are coming to the market for the influenza. So generally, if we're, we do offer it to pregnant women at 22 to 24 weeks of pregnancy. So you can get yourself an influenza vaccine itself. It can protect you from influenza, the flu, or cough, cold, and things like that. So what are the special circumstances? So what I have discussed before was a routine vaccination schedule. Now there are some special circumstances where we can give certain vaccinations. So if I don't have any reason to give it, I will be avoiding it. But if I have a reason to give it, so I can give these vaccinations. That's what I mean to say. So the pneumococcal vaccine. So there is again a polysaccharide vaccine only, and it has to be given only in the 2nd and 3rd trimester. So HIB, like that is for the Haemophilus influenza type E. This is given for patients who HIV, sickle cell anemia, splenectomy, patients who've got their spleen removed, or patients who've got cancers like leukemia. That's where we give this vaccination. Meningococcal vaccination can be given hepatitis A and B, especially hepatitis B. Some of them have missed it. Some of them are born in the villages and they wouldn't have seen the hepatitis vaccinations, or they would have not gone through the Hep B vaccinations, or their immunity would have been less. The husband is now hepatitis positive, or then, we vaccinate the mother during the pregnancy to save the baby, keep the baby and the mother safe. So yellow fever vaccination is only recommended if you are planning to travel to a place where yellow fever is very predominant, especially if you're traveling abroad, to countries where yellow fever is very prominent. That's where we give it. So inactivated polio vaccine, that is the IPV, that is what we give these days. So, and the typhoid, partially protective, there's no point in giving it, but if you want to take it, you can take it. And the rabies vaccination can be given. This is one more thing which a lot of patients have come up with, rat bites, and they have this dog bites. So they come back to ask us, can I take the rabies vaccination? Yes, dog bites, please take the rabies vaccination. There is no problem. So you have to get yourself vaccinated for rabies. So that is during animal bites. You can take the rabies vaccination. Coming to COVID-19, I'll discuss it later at the end of the program, whether to take, not to take, what are its effects and side effects. So we will do it later. So next, there are certain vaccinations which we completely avoid during pregnancy. That's your HPV vaccination cannot be given during pregnancy. That's why please remember, get yourself vaccinated either before you get pregnant, because it is 016. So you need 6 months time for your complete vaccination schedule of HPV. Otherwise, you get it after delivery. That's postpartum. Don't do it during pregnancy. We cannot do a HPV vaccine. MMR, again, generally, when a patient comes for preconceptional counseling, we check the rubella status. So if the rubella is negative, we ask them to take the vaccination, MMR, and then wait for at least 3 cycles or 3 months for the immunity to develop, and then you can plan your pregnancy. Because if you develop rubella in pregnancy, it's going to be very scary. The baby will develop a lot of malformations inside. It may not be a healthy baby. So, and if you had got yourself vaccinated and then you conceive the same cycle, generally people say, please, do not do that. But in case if you conceive like that, so it's okay to do that, but still it's not safe. We do not know the effects of these vaccines on the fetus per se. So even though the weaker virus is injected into your body, but still MMR vaccine is a big no. If you are pregnant or if you're planning for pregnancy, you better take it before pregnancy. You give yourself 3 months and then plan a pregnancy with MMR. Chickenpox vaccine again cannot be given, and the BCGs for tuberculosis, that also cannot be given during pregnancy. So these are the absolute contraindication vaccinations in pregnancy. Postpartum vaccinations, now again, you can, as I told you, HPV, the MMR can be taken, that's but the chickenpox vaccine can be taken. And now the government has given permission for COVID-19, so breastfeeding mothers can take the COVID vaccinations. So you can go ahead and take the vaccination. Coming to the hottest topic of probably, in all my careers, I've never got so many, messages and calls and asking me about the COVID vaccination, whether to take, not to take, whether is it safe to continue or not. To be very honest, there is a limited data available, but there have been studies in animals. In Moderna, Pfizer, and J&J have done animal studies in pregnant mice to find out the effects on the fetus. Fortunately, they found no safety concern in pregnant animals or their babies. So they said it was quite okay, right? So the Pfizer, Moderna are mRNA vaccines. J&J is a viral vector vaccine. That's why I discussed these things in the beginning with the types of vaccinations. So Pfizer, Moderna, and mRNA, or mRNA, they are the mRNA vaccines. J&J is a viral vector vaccine. So they have done studies on all these 3 vaccines and found no safety concerns in pregnant animals or their babies. But as such, the countries, Western countries, are vaccinating their pregnant women. Probably the studies will come a little later with whether there is any effect on the fetus or not. Okay. mRNA vaccines. So what are these? These vaccines do not use live virus that cause COVID-19 vaccination, COVID-19 disease. So it does not use a live virus. So please remember that it does not use a live virus. Okay. And it never enters the nucleus. So nucleus is where your DNA or the genetic material is stored. but mRNA does not, the vaccine per se does not affect the nucleus of the cell. So it does not enter the nucleus. So it's always in the cytoplasm. It just comes, does a little bit of work, and then it just goes away. It is not going to stay or change the genetic material, or it's not going to impact negatively, is what they are saying about the mRNA vaccine. So recently, the Harvard Gazette, the Harvard Hospital, the Harvard University, along with the MIT and MG Hospital in the US, and everything is in Massachusetts. That's where they did the research, have found that COVID-19 vaccines be highly effective in producing antibodies against the SARS-CoV-2 in pregnant and lactating women. Study also demonstrated vaccines give protective immunity. They pass on passive immunity to the newborns through the breast milk and placenta. But this study was very, what I would say, for 130 women, that's it. It's a small study. We don't consider it a major, it's not a peer-reviewed study or anything like that. So we just consider this a very small study, but it's a significant step towards, proving the efficacy of vaccinations or the safety of vaccinations. So this is about COVID-19 vaccine. If the government of India gives the permission for a pregnant woman to be taking a vaccination, please go ahead and take it. But right now, they've not given us any permission, but this is what is going abroad in other countries. And breastfeeding women, kindly go ahead and take your vaccinations. So again, the question which comes up is Covishield or Covaxin, which one to take? Please take whatever you get. So both the vaccinations have been proved, the efficacy have been proved. You can take a Covishield, you can take a Covaxin, but we have come up with a lot of studies recently saying don't mix up the vaccinations. If you have taken the Covishield, please go ahead with the Covishield. If you've taken a Covaxin, go ahead with the second dose of Covaxin as well. So yesterday or day before yesterday, I was reading an article about it. And the best part is the European Union today has agreed to vaccinate all the children above the age of 12, and I'm sure the US also has started vaccinating its children above the age of 12. Our children desperately need it because we want them to go back to schools, isn't it? So they are so bored and depressed at home. So probably the government will come up with a strategy for that. And Covaxin has already been tried. They are doing trials for the children. Now, coming to Covaxin versus Covishield. So Covaxin is an inactivated vaccine. And as they told you multiple times, I'm sure the company has come out and told it will take time. It's a time-consuming vaccine. They need time to produce that vaccine. It's a dead virus. And this technology, what they are doing, the whole virion inactivated virocell-derived technology, it takes time to produce the vaccine. So that's the reason why it's getting delayed to come into the market. But otherwise, Covaxin, Covishield, doesn't matter. Covishield is a chimpanzee adenovirus enabled to carry the COVID-19 spike protein. So once it comes, it teaches our body the immunity and then just goes away, right? So this is all about the vaccinations. So at the end, let's come to the takeaway points. I would say adolescents, please don't neglect vaccinations. 10 to 19 years of age, please be good with your vaccinations. So I want you to look at the slide again. So for adolescent vaccinations, HPV, please, MMR, kindly take these two vaccinations, chickenpox as well, so that during pregnancy, you're protected for all these things, MMR, HPV, and chickenpox. So if you have girls at home, make sure you look at their charts to see if these things are over, right? Okay, so breastfeeding women can take the COVID vaccinations, and there are quite a set of vaccines for the breastfeeding women that can take. So HPV, MMR, varicella, and COVID-19 vaccines can be taken. Covaxin, Covishield, doesn't matter. Please go ahead and take. If the government of India gives you permission to take for the vaccine for pregnant women, please take it. But there are lots of studies going on right now. Even though the data is limited, the Harvard Gazette has put in this paper in their article, paper saying that they found vaccine-protected immunity to the newborns through breast milk as well as placenta. So that's a lovely news for us. So with that, I end this session. Now we are open for questions. Any questions?
Hello.
Yes.
This is Saraswati.
Yes.
I wanted to know after delivery what would be the ideal time gap for taking the vaccination for COVID? Maybe a month or so later we'll can proceed with the vaccination, or very immediately also can we take it?
You can absolutely take it as soon as you deliver the baby, ma, not to worry.
Okay, thank you, ma'am.
Yes. Any other questions? Thank you. Have a nice day. Thank you so much. Stay safe.